Martin Luther King Jr. said never lose infinite hope. And on this day honoring him, the University of Maryland Medical System held a town hall on finding hope in the COVID-19 vaccine. Doctors also discussing how the pandemic has adversely impacted minority populations. WMAR 2 News' Abby Isaacs explains.
We're a year into this pandemic. Almost 400,000 Americans have died, but the vaccine brings hope for an end. Still, there are a lot of concerns, especially from minority populations, about getting the doses. Well, the goal of today's town hall was to ease those fears.
It has been a struggle, but Dr. King told us to remember to keep the hope alive.
In the midst of a devastating pandemic, doctors say that hope is the vaccine. But distribution is only one of the challenges when there are large populations who don't trust the science because of history.
We have a history in this country of performing harmful research on communities of color, of exposing them to unnecessary risks, of not fully explaining the research that we're doing, and in treating them as an experiment without their consent.
On Martin Luther King Jr. Day, the University of Maryland Medical System held a virtual town hall with 5 physicians to address those concerns.
What we have found that's most important is there was no difference in the effectiveness of the vaccines for the different populations, different demographics.
They took questions from the public about vaccine effectiveness, how it works, and why they chose to get it themselves.
You cannot get COVID-19 from these vaccines. The vaccines do not contain any part of the live virus.
Doctors cited the adverse impact on minority groups, who are 1 to 3 times more likely to get COVID-19, and health comorbidities increase the likelihood of complications. Panelists also acknowledged the systemic health and social inequities, like lack of access to health care, that make that risk even worse. Adding those issues need to be addressed during distribution, and the vaccine being free removes one barrier.
Our communities, our Black and Brown, our Latina community who carry so much of this COVID burden, 3 times more likely to die. It is so important, especially important that we are there and getting that vaccine. I cannot stress it enough.
We're sick of this. We are over COVID. The only hope we have is this vaccine. And folks, I'd much rather take my chances with this vaccine than to take my chances with the COVID infection.
The panel wasn't able to answer all the questions submitted, so the UMMS webpage titled Finding Hope will be updated throughout the week with more information, and it's also available in Spanish. For WMAR 2 News, I'm Abby Isaacs.